So how many people are walking around Utah with COVID-19 and don't even know it? Some are testing positive for the virus and have never showed symptoms, and they're unintentionally spreading the virus, according to health officials. ABC4's Brittany Johnson looks into the issue.
As many Utahns and people around the world continue to test positive for COVID-19, we're learning many of them never had symptoms. But health officials say they are saving testing supplies for those who need it most and not people who don't have symptoms. It's day 5, and Tony Jones is still confined to this room.
My world right now is about 400 feet.
We've been following his journey since last week when he tested for COVID-19. The test came back negative, but Jones still remains in isolation. It's a precaution after coming into contact with 2 Jazz players who tested positive for COVID-19.
I'm asymptomatic at this point, and just because I've tested negative, it takes the full 14 days for me to be out of the woods, so to speak.
Asymptomatic means someone doesn't have symptoms of something, in this case, COVID-19. But there are people such as jazz star Donovan Mitchell and actor Idris Elba who are testing positive for the virus but are asymptomatic.
So clearly, we have a multiple sample size of people coming up with positive tests that are asymptomatic. And the issue is that how many people are walking around not knowing that they're sick.
Dr. Angela Dunn, state epidemiologist with the Utah Department of Health, says they're working to figure out how someone can be infected and asymptomatic.
What we do know is that you are most effective at spreading the disease if you have symptoms. So coughing, sneezing, having shortness of breath, that's when you have the most virus in your body, and that's when you're most effective at spreading it. So people who are asymptomatic, while they may be able to spread it, it's not a major driver in the pandemic.
Nationally, there's limited testing kits available and protective gear for healthcare workers. It's the same story here in Utah. Dr. Dunn says their focus is on testing those in high-risk populations who need it most.
Our hospitalized patients and our healthcare workers and patients in long-term care facilities, those are the highest risk populations, and we want to ensure we have the capacity to test those populations.
So who should be tested for COVID-19? According to the state, anyone who develops a fever and symptoms such as cough or shortness of breath within 14 days after travel from an area with widespread coronavirus illness, or had close contact with someone showing these symptoms who recently traveled from an area with widespread coronavirus illness. You can find details on our website, abc4.com. Reporting in the newsroom, I'm Brittany Johnson, ABC4 News.